Hello guys, welcome back to my channel. This is Nurse JBS and today we're going to answer a sample case study in preparation for the next generation NCLEX, which will be starting on April the 1st, 2023. That's 2 months from now. This new format will measure the nurse's clinical judgment. So each test taker will receive 3 case studies. Each case study is 6 points. That's times 3 is equal to 18 questions all in all, or 18 points. And the rest will be standalone questions. Remember that on April the 1st, the maximum or the minimum number of questions that you need to answer is 85 and a maximum of 150. That includes the scored and the unscored items. However, you will not be able to know if each question is scored or unscored, so that you'll be serious in answering each question. So without further ado, let's get started. And by the way, each candidate will have 5 hours to take the test. Let's jump right in. The nurse in the emergency department is caring for a 78-year-old female client. Nurse's notes at 10 a.m. Client was brought to the emergency department by the client's adult child due to increased shortness of breath this morning. The adult child reports that the client has been running a fever for the past few days and has started to cough up greenish mucus and to complain of soreness throughout the body. Client was hospitalized for issues with atrial fibrillation 6 days ago. History of hypertension, vital signs, temperature 101.1 Fahrenheit or equal to 38.4 degrees Celsius, pulse rate of 92, respiratory rate of 22, the blood pressure is 152/86, pulse oximetry reading is 94%, on oxygen at 2 liters per minute via nasal cannula. On assessment, the client's breathing appears slightly labored and coarse crackles or ralls are noted in the bilateral lung bases. Skin slightly cool to touch and pale pink in tone. Pulses is 3+ and irregular. Capillary refill is 3 seconds. Client is alert and oriented to person, place, and time. The adult child states, "Sometimes it seems that my parent is confused." Peripheral venous access device placed in right forearm. Question. Select the 4 client findings that require immediate follow-up. So what comes to mind? This is like answering select all of that apply method, right? So when you answer questions like select all of that apply, we usually use the true or false method. So let's start to answer this question. So what are the 4 client findings that we need to follow up? So the choices are vital signs, lung sounds, capillary refill, client orientation, radial pulse characteristics, and characteristics of the cough. From out of these 6, we only need to select 4. So let's start with vital signs. Do we need to require immediate follow-up for the vital signs? It's true. See, the vital signs are abnormal. The temperature is 101.1 degrees. The patient has fever. It means that the patient might have infection or sepsis or anything like that. So also the patient is hypertensive. So the vital signs need immediate follow-up. That's true. How about lung sounds? You can see and you can read that the patient has crackles or ralls. You only hear crackles or ralls if there is something wrong with the patient's lung. So the patient might have COPD like bronchitis. You can hear that sound, crackles. They are often with people who are having bronchitis. You can hear that sound, crackles. So that would require immediate follow-up. So lung sounds. Next, capillary refill. It doesn't need to be followed up because it's a normal capillary refill. The normal is 2 to 3 seconds for adult. How about client orientation? No, it doesn't need a follow-up because the client is alert and oriented to person, place, and time. So it doesn't need to be followed up. How about the radial pulse characteristics? Yes, it needs to be followed up. Remember, skin slightly cool to touch and pale pink in tone, pulses 3 plus, it's bounding and it's irregular. So we need to follow up radial pulse characteristics. How about characteristics of the cough? It says there on the nurse's notes that the patient has started to cough up greenish mucus. It means that the body is working hard to eliminate the bacteria, meaning the body is fighting off the infection. The patient's WBCs are working hard to eliminate the bacteria, so that's why the patient cough up greenish mucus. So there could be infection in this patient or sepsis. So what are the 4 client findings that require immediate follow-up? So the 4 correct answers are vital signs, lung sounds, radial pulse characteristics, and characteristics of the cough. So you check off 1, 2, 5, and 6. So this is just a sample on how you will answer case studies on your NCLEX-RN. On the left side will be the situation. You will be able to check the nurse's notes, laboratory results, any information that you need to answer the question. And on the right side is where the question is. So that's how you will answer your case study. See you on the next video. Thank you so much. Bye.